All right, hello and welcome to another Colebrook Public Podcast discussion. Tonight our topic is palliative care, and here to present the topic is Physician Assistant Lindsay Foss. Thank you for joining us. Would you like to introduce yourself, Lindsay?
Thanks, Elise. I'm Lindsay Foss. I'm a physician assistant with North Country Home Health and Hospice Agency, and I've been part of the team for over 2 years now, and part of the hospice program, and now part of the palliative care program, which I'm planning to talk to you folks about tonight.
All right, thank you. Before we start our presentation, I wanted to remind everyone that if you have any questions, please type them into the chat or comment section, and we will have a question and answer time at the end of the presentation. All right, take it away.
Thanks, Elise. And thanks to the Colebrook Public Library for putting on this series. I think it's a wonderful resource for the community. So as I said, I'm here to talk about our palliative care program. It's a new program that's part of our agency. We have a total of 3 programs. We have Home Health, which is a program that helps, brings care into the home and helps get patients back on their feet after a surgery or a hospital stay to help them regain strength and other things. And then we have our hospice program, which is a program for those in the last months of life to help provide extra support, focusing on comfort. And that's also a wonderful program. And what we found is with these 2 programs, there was a large group of people in between that didn't fit in either program, but could really use some help in their home and in the community. And so that's kind of where our palliative care program came from, was a way. We did some research looking around, what can we do to really reach the community and meet this need, and palliative care is what we found to be the best fit. So we've been developing that over the past year or so. And so let me move on to the next slide. There. So you might be wondering what palliative care is. And so palliative care is a medical specialty, just as cardiology or pulmonology or oncology. All of these are all medical specialties. And so palliative care is one of these specialties that focuses on providing relief from symptoms and stress of serious illness. And the goal of palliative care is to improve the quality of life for the patient and their family. And there's a lot of evidence in our country showing that where there are palliative care programs in the community, it is improving the patient's quality of life and is making that positive improvement in the patient's care. And our palliative care program or palliative care in general, is available to patients with any serious illness and any age and any stage in our illness. And so the stage means you may be at the beginning, at the diagnosis of a serious illness, or you may be having years of an illness that is a chronic illness that is becoming a bit more difficult to manage. And there's things we could help with in that setting. So really any stage, beginning, middle, and any area, palliative care can be utilized. And palliative care is a medical treatment that can be provided alongside any other providers that you may have. So alongside your primary care physician, we're able to provide our care along with your PCP's care or your cardiologist, whomever it may be that's part of your medical team. We're not our goal is not to replace them by any means. Our goal is to support you and support them in all working together for you to, for your medical care as best we can. And this image on the slide here shows the patient and family in the center, which is really what palliative care is all about, is keeping the patient and their family at the center of our care. So your goals as a patient are really what our goals are. We support you in that but through a number of different ways. So palliative care can be confused with hospice. The words can sometimes be put together in different programs, or when you're reading about hospice, you might come across palliative care and vice versa. But they're really two separate avenues you can take toward your care. And so I wanted to compare them and contrast them a bit to help give you an idea of what the differences are and the similarities. So palliative care is, as I said, for serious illness, for chronic, typically it's a chronic illness. And hospice care, on the other hand, is more for terminal illness. So we know that there isn't a cure for this illness, or that we're nearing, closer, like I said, the last months of life. Also, palliative care, in contrasting the two, is appropriate when you're seeking life-prolonging treatment or curative treatment. So you are seeking to feel better, and you still want to pursue those treatments. While hospice care is you're seeking to feel better, but you're at a place where there's not a curative treatment and you're not seeking that, you're seeking more comfort. Now, down at the bottom there with the arrow, it shows that these are two things that are consistent between both programs, both palliative care and hospice care. And both can improve the quality of life for the patient with an illness, and both provide emotional and spiritual and physical support to manage symptoms. Also, a difference between the two programs is what we can provide. And so hospice care is a benefit hospice is a benefit that's provided by all insurance companies. And so it is a benefit that we can really get extra support in the home: nursing visits, aid visits, social worker, homemaker, depending on what your needs are. And as you'll see as we talk about palliative care, it's not as an inclusive program. It's a very different program. And we'll talk about that as we continue here. So when to utilize palliative care. So I've brought up serious illness a couple times. So you might be wondering, what is serious illness? What would qualify for that? Is that me? Is that my family member? And so we've put together a list here of some examples of illnesses or diseases or medical conditions that would be considered serious illness. And that includes cancer, Alzheimer's disease, or other types of dementia, COPD, which is chronic obstructive pulmonary disease, or other lung conditions, Parkinson's disease, congestive heart failure, or other cardiac conditions, ALS, kidney disease, multiple sclerosis. So as you can see, these listed tend to be chronic illnesses that can have a lot of uncomfortable symptoms associated with them. And these illnesses also have, in some cases, many treatment options. And so those you would pursue through the appropriate specialty, and then our specialty with palliative care can be added on to help manage any side effects from the medications or treatment, or just helping manage the symptoms of the disease itself. So the goals of our palliative care program are to support the patient and their family. Obviously, the patient is our primary focus, but oftentimes as patients, we have family members who are a huge part of our life. And so supporting them is very, very important. And so they are definitely part of the equation as we approach your care through palliative care. We also treat symptoms and improve health where possible. We're not miracle workers. We wish we were, but we're not. But we will do our best to contribute to your quality of life in a positive way. We ensure patient and families have an understanding of the disease and treatment options. So part of what we do is having this discussion about what disease or serious illness you're dealing with and what options there are for treatment. Oftentimes, we're able to come in after you've had some discussions with different specialists and help sort through those with you, give you an opportunity to maybe consider your options and discuss it further. And that's part of what we do is providing you with that information, and everyone has a different level of comfort with that, whether they want all the details or they just want the basics. And so our approach is to see what your wishes are and what your desire is for level of information, and then we do our best to accommodate that. Also, a goal of palliative care is to allow meaningful interactions between patients and their friends, family, and community, where relationships are so important. And we really try to get a big picture view, a holistic view of all things that are important and all things that may play a role in your decisions and in supporting you and your wishes. So we do try to get a good, accurate view of what it is you want in palliative care. Now, if you're wondering if palliative care is right for me or my family member, my loved one, to get into our program, there's a couple of different avenues or to be considered for our program. One would be to discuss with your primary care provider, make an appointment with them, or at your next visit discuss it with them and just say, I'm interested in palliative care. Do you think that would be a resource for me? And it wouldn't have to come from your PCP. If there was a specialist that you had a great relationship with, they may be someone to discuss it with as well. As an alternative, you could reach out to our agency directly and ask to speak with someone from our palliative care team. And we can discuss the options with you and get the ball rolling from there. So that number for the agency is 603-444-5317. And that would be, as I said, one avenue to initiate the process of, is palliative care right for me? And so if this is a program that's a good fit for you, then what it would look like is our providers, which is myself, a physician assistant and a nurse practitioner, and we would have a consult visit with you, or you would have a consult visit with a medical social worker. And we determine what visit is most appropriate based on your needs. And the visit is in your home. Our agency is all about home-based care and bringing the care to you. And we cover a large geographical area. We cover all of northern New Hampshire, which includes all of Coos County and the northern half of Grafton County. So our agency does cover quite a large area, but we have a good understanding of the needs in our area because it's sometimes difficult to get to appointments. And sometimes it's easier to bring the appointment to you, especially if you're dealing with a serious illness. And we are developing the program one step at a time. So we have this program and these ideas, and we're moving forward, but we're also keeping an open mind and readjusting the program to the needs that we're seeing in our community. So you would start with the initial consult visit, and then we would address symptom management in consultation with your current medical team. So if we came to visit and felt like and had some suggestions as to help with your medical care to support you in your care, then we would communicate with your medical team and make those suggestions and have a discussion. Also, we help with advanced care planning, whether that's discussing what your plans are, filling out any documentation that you have been wanting to fill out or have been thinking about or want more information about. We're able to bring all of that to your home as well. And also social and spiritual support. So we're supporting you where you are, in what your beliefs are, or your social situation is. So we're really doing our best to meet you where you are and provide the care that best helps you meet your goals. And I believe that is all I have to share on the palliative care program. If anyone has any questions, I'd be glad to answer them.
This is Elise. I was just chiming in. Are there any steps you're taking during this COVID time? Are you doing video? How are you providing your services right now?
Yeah, that's a great question. So we are definitely taking precautions, and the safety of the community is very important. We are implementing a number of different things. Zoom visits are one of them, or frequent phone calls if visits, physical visits aren't as possible. We're also doing precautionary COVID testing within our agency to keep safety at and awareness at a high level. And we've also implemented different safety gear. So in the homes, what we're required to wear, we've been adjusting based on COVID in our area. So yes, we've been definitely making adjustments.
All right. And the other question is, where can they find more information about this specific program?
So you can go online to our website, North Country Home Health and Hospice Agency. And there is information there. You can give us a call. As I said, our phone number is 444-5317, and you could speak to one of us more about the program. And I would say right now, those are the best two ways to access information.
All right. I'm not seeing any more questions right now. So I just wanted to say thank you so much for coming on and sharing this information. Hopefully people learned about it and maybe thought of someone that could use a little help. So reach out via, and they could probably reach out via Facebook.
I would say so. I don't manage the Facebook, but if someone had questions and reached out, I'm sure we could respond. Marianne,
All right.
Yeah, we definitely can questions via Facebook. We check daily, and I would get those right over to Lindsay.
Awesome. So if you have more questions, you can post them on the video on Facebook, and we can make sure that they receive those. Go to their website, call them, or send them a question on their Facebook page. I just want to say thank you so much for joining us again. I learned a lot, and I hope that everyone else got something out of it as well.
Thanks, Elise.
All right. Thank you for everyone joining us, and have a great evening.